Hey everyone! Welcome back to the channel. Today, we're diving deep into a topic that affects millions of people worldwide, Crohn's disease. Whether you've just been diagnosed, know someone who has it, or are just curious, this video will cover everything you need to know, from symptoms and causes to treatments and lifestyle tips. By the end, you'll have a complete understanding of this condition, so stick around. Crohn's disease is a type of inflammatory bowel disease, IBD, that causes chronic inflammation in the digestive tract. It can be painful, disruptive, and sometimes even life-threatening if not managed properly. But with the right knowledge, people with Crohn's can live full, active lives. This is going to be a long, detailed guide, so feel free to use the timestamps in the description to jump to sections that interest you the most. Let's get started. What is Crohn's disease? Crohn's disease is a chronic inflammatory condition that primarily affects the gastrointestinal GI tract. Unlike ulcerative colitis, which only affects the colon, Crohn's can impact any part of the GI tract, from the mouth to the anus, though it most commonly targets the small intestine and colon. The inflammation in Crohn's disease often spreads deep into the layers of the bowel tissue, leading to complications like strictures, fistulas, and malnutrition. It's an autoimmune condition, meaning the body's immune system mistakenly attacks healthy tissue. Types of Crohn's disease. There are several subtypes of Crohn's, classified by the affected area. Ileocolitis, most common, affects the ileum and colon. Ileitis, only the ileum, small intestine. Gastroduodenal Crohn's, stomach and duodenum. Jejunoileitis, upper small intestine. Crohn's colitis, only the colon. Each type has slightly different symptoms and complications. Causes and risk factors. The exact cause of Crohn's is still unknown, but researchers believe it's due to a combination of factors. Genetics, family history increases risk. Immune system dysfunction, body attacks gut bacteria. Environmental triggers, diet, smoking, pollution, gut microbiome imbalance. Gastroenterologist, we've identified over 200 genetic markers linked to Crohn's, but not everyone with these genes develops the disease. Environmental factors play a huge role. Risk factors. Age, commonly diagnosed in teens and young adults. Family history, 15 to 20% of patients have a relative with IBD. Smoking, doubles the risk and worsens symptoms. Diet, high in processed foods may contribute. Urban living and industrialized countries, higher prevalence. Symptoms and complications. Symptoms vary depending on disease location and severity, but the most common ones include abdominal pain and cramping, diarrhea, sometimes bloody, fatigue and weight loss, fever and night sweats, mouth sores, reduced appetite and malnutrition. Patient. At first, I thought it was just food poisoning, but the pain never went away. I lost 20 pounds in 2 months before I got diagnosed. Complications. If left untreated, Crohn's can lead to severe complications like strictures, narrowing of the intestine, fistulas, abnormal tunnels between organs, abscesses, infected pus pockets, colon cancer, higher risk with long-term inflammation, bone loss and anemia due to malabsorption. Diagnosis. Diagnosing Crohn's involves multiple steps because its symptoms overlap with other conditions like IBS and infections. Tests include blood tests, check for anemia and inflammation, stool tests, rule out infections, colonoscopy and biopsy, gold standard for diagnosis, MRI, CT scans, see strictures and fistulas, capsule endoscopy for small intestine imaging. Treatment options. There's no cure for Crohn's yet, but treatments aim to reduce inflammation and prevent flare-ups. Common medications include anti-inflammatories like mesalamine, Steroids, prednisone for short-term relief. Immunosuppressants, azathioprine, methotrexate. Biologics, Humira, Remicade, target immune proteins. Antibiotics, for infections and fistulas. Surgery. About 70% of Crohn's patients eventually need surgery due to complications. Procedures include strictureplasty, widening narrowed intestines, bowel resection, removing damaged sections, colectomy, removing part or all of the colon. Diet and lifestyle management, foods to eat and avoid. While diet doesn't cause Crohn's, certain foods can trigger flares. Recommendations include low-fiber foods, white rice, bananas, lean proteins, chicken, fish, probiotics, yogurt, kefir, dairy, if lactose intolerant, spicy foods, alcohol, caffeine. Nutritionist. Keeping a food diary helps identify personal triggers. Hydration and small, frequent meals also help. Stress management. Stress doesn't cause Crohn's, but it can worsen symptoms. Techniques like yoga, meditation, and therapy can help manage stress. Living with Crohn's, mental health and support. Living with a chronic illness is tough. Many patients experience anxiety and depression. Support groups, online and in person, can be lifesavers. Pregnancy and Crohn's. Women with Crohn's can have healthy pregnancies, but should plan with their doctor to adjust medications. Latest research and future treatments. Scientists are exploring stem cell therapy, new biologics, fecal microbiota transplants, FMT, personalized medicine based on genetics. If you or a loved one has Crohn's, remember, you're not alone. With proper treatment and lifestyle adjustments, many people live full lives. If this video helped you, smash the like button, subscribe, and share it with someone who needs it. Drop questions in the comments. I'll answer as many as I can. See you in the next video. Stay strong.